Welcome to Duke Spine Institute live stream spine surgery. Our patient is from Israel. Now, he is not our first patient from Israel. We've had others. We've had actually Mossad that I've operated on in the past. But he's the first to put the pin on our world map onto Israel. I guess our Mossad did not. Were you here for that guy, Henry? Maybe it was before your time.
I don't think so.
We did a testimonial with him too. That was a long time. Maybe it was about 8 years ago.
Oh yeah, no, I was not here.
Yeah. So our patient traveled all the way from Israel to have his back and neck fixed. Today we're going to do his lower back. He has a herniated disc at L4-5, the most common disc to cause back pain. And we're going to go in and basically perform our Duke laser disc repair. That's the surgery he wanted to have performed, and it was the right choice. But in addition to his disc, he also has facet joint pain. We're going to fix his facets as well. Let's go ahead and show our audience the most common causes of chronic lower back pain. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine touches the vertebral bodies with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. And welcome back. You can see from our video, there are many causes of lower back pain, but most common cause is an injured disc, and that's what this patient has. That is his primary cause of lower back pain. He has other causes. The second cause is his facet joints. We're going to fix those next. So we're going to start by repairing his disc, then we're going to fix the facet joints. Are you comfortable?
How are you doing, my friend? You okay? Open your eyes.
All right. Well, we were hoping to do a discogram and see if that is causing his pain, but unfortunately, he is too sleepy, so we're going to proceed. All right. If you have questions, feel free to ask me. But this disc, L4-5, has a tear. It's worse on the right side. That's why we're doing the right side. His pain is on the right side. So we're going to go in and do our Duke laser disc repair. And then when we're done here, we're going to do the Duke plasma rhizotomy for the facet joint pain. Any questions?
Yes, we just got a question coming from Brittany on YouTube.
He needs a little bit more. Hi, Brittany on YouTube. Feel free to fire away. I'll do my best to answer your questions.
Asking if you have 3 levels of degeneration from L3-4 to L5-S1, with L4-5 being the most symptomatic, what is the risk of ADS for a single level fusion at L4-L5?
It's very high. I would say probably 95% adjacent segment disease. So what Brittany's saying is, I've got 3 bad discs. They're probably all causing symptoms, but my surgeon only wants to fix 1. And what's the chance I'm going to need the other ones fixed? I would say 95% chance you're going to be back for more surgery. Do not do a fusion, Brittany. The best treatment you can do is what you're watching right now. But before you even get this treatment, first, do our free MRI review. Let's get a AP real quick. Okay. Our MRI review is free. You can do it from the comfort of your home. You don't have to come to our office. We do it for free. There's no charge. All I need to do, it's perfect, is see your MRI and go over it with you. Okay? And I can tell you on that Zoom call exactly why you have back pain and whether or not you need 1 disc fixed or all 3. I suspect you're going to need more than 1. And the reason I say that is because in our patients we've been treating for the last 20 years, we found that our patients need, on average, okay, they need 2.4 discs per patient repaired. 2.4. That's basically 2.5. So you would be probably in that 3 disc category that needs to be repaired. The problem is if you get a fusion, you're guaranteed to have pain at the other disc. You're guaranteed to need a second surgery. And fusions are very dangerous surgeries. They're bloody, they're painful. You have to take narcotics afterwards. So why would you ever want to do that more than once? I wouldn't want to do it once, let alone more than once. Best thing you can do is come here, get the laser surgery, avoid fusion, avoid hospitalization, avoid metal, avoid narcotics, avoid complications. But thanks for asking. Hope I answered your question. Well, Henry, let's show the audience how we repair herniated discs like this. All right, laser. You guys see the inflammation on the outside of the annulus right there?
Yes, we do.
That is the source of his pain right there. You see the blue? The blue is degenerated nucleus pulposus. It's bulging out, pushing the annulus, and you've got inflammatory tissue right there on the annulus. So you're basically looking at a disc zit. A disc zit. A zit full of inflammation, but it's not a zit, it's a disc. A disc that's injured. This is going to do wonders for him. Any questions?
No current questions. There's a comment from Brittany, once more on YouTube, saying thank you for your answer. My husband and I have an appointment tomorrow morning with you. Looking forward to it.
Oh, wonderful. So looking forward to meeting you and hopefully answering your questions. All right, so far everything's going well. What am I seeing here? Well, the laser, for your reference, by the way, is about 1 millimeter wide. That's the glass fiber you're seeing, glass fiber. It's a fiber optic fiber. And basically that glass, you see where it ends right there at the tip? That's where the laser energy is released from, right there at the tip. It doesn't come off the sides, it comes out of the tip. We call this a straight firing laser because it fires straight. The energy comes out straight, which is what I like. Some surgeons who do laser surgery like side firing lasers, but there's nobody in the United States that does that. I'm the only one using the laser to repair discs currently. There are side firing laser fibers as well. I don't like them, I don't use them. This is a much better option. It works. Where are we at? 52.5? Yes, sir. Very good. Now, what am I seeing? A lot of scar tissue, a lot of herniation. The blue stuff is the herniated nucleus, the degenerated herniated nucleus. The white stuff right there is the annular tear. It's the annulus fibrosis. This white stuff right here is scar tissue from chronic inflammation. The gold stuff is calcification. Should not be there. You should not have calcification. The only reason there's calcification is because this disc has been damaged. If there was no damage to the disc, then there wouldn't be calcification. Look at the blue dye. That's all nucleus, herniated nucleus stuck within the annular fibers. That is what's causing the inflammation and back pain. We're going to have this cleaned up in about, 2 minutes, Dr. Berndes. Then we're going to move on to his facets. This is going very well for him. By the way, what's interesting, he's from Israel. He flew here. He's not our first Israeli here. I remember now we had a Mossad, which is military. And that patient, we actually have a video of them. I fixed his back. And we have a testimonial from him somewhere buried in our hundreds of patient testimonials. But you can probably find him. He's very tall. He's obviously, he looks like he's Mossad. Of course, I didn't talk about that at the time. We don't want to identify him as Mossad. But that said, this laser that we're using is made in Israel. It's now owned by Boston Scientific. Boston Scientific is a medical device company in the United States, multinational. And basically, they bought the lasers and they paid $1 billion for the laser company and their book of business. And now they've taken the lasers, they've doubled the price of the laser, and they've made the laser fibers 10 times more expensive for us. So, unfortunately, actually more than 10. They're about 20 times more expensive, right? So our costs have gone up. We've kept our costs for the patients the same. We've not raised our costs, but we're obviously having to pay a lot more, unfortunately. Okay, just about done. Another 30 seconds. See how quickly the laser dispatches of all this bad tissue right here? Nikki,
we do.
you see that? Henry, you see that?
Yes, sir.
Okay, that's how it's supposed to work. So when you guys see it not working well, obviously we got to change the fiber or change the machine. So, all right.
And
30 seconds left and we're done. Any other questions?
At this moment, no current questions. So in the meantime, as we're finishing up, why don't we show the audience of how it is that we cure herniated discs with this procedure?
Back pain.
Back pain.
From a herniated
From
disc.
a herniated
Yes.
disc, of course.
Then we'll be back to do the facet treatment, okay? So we're going to end the stream, but we'll be back and we're going to do his facets next.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800